Hello, how are you guys? I'm back again, alright, so what we're gonna do is we're gonna do some more Anki. We're gonna do some flashcards, alright? So, I wanna try and finish this. I wanna really try and finish this. The chest x-ray findings of interstitial lung disease are sort of kind of radical nodular. I think we kind of know that, so that's kind of easy. Three possible abnormal joint findings, X-ray, rheumatoid arthritis. What are we looking at? Osteopenia is one. Narrow joint space narrowing, and osteopenia. And then what's the other one? I think spicules. It's called bony erosions. Good enough, I guess. Myelomeningocele, other structural defect. Was it the Chiari malformation 2? Chiari, that's right. I'm good. I'm good at this. I wonder if you can see me properly. You can. Okay, that's good. So management of COPD, if you have like an exacerbation of COPD, what do you want to do? Obviously O2 you want to give. What else? Give an antibiotic, I assume. What else? Bronchodilators. So SABA, SAMA, you got that 5-day course glucose. So we're looking at SABA right here. You got SAMA. Do you also want to look at like glucocorticoids? So you got to have that as well. Antibiotics is important. I mentioned that. And oxygen. I mentioned oxygen. So just remember SABA, SAMA, and like your glucocorticoids. So that's kind of cool. So 7 bacteria reactive arthritis. We know Shigella, Salmonella, Campylobacter, E. coli, Yersinia, Salmonella. We did Campylobacter. What did we miss? Chlamydia. Yeah, we missed chlamydia. The clam. We forgot the clam. You got C. diff. You forgot C. diff as well. Good. What is the best predictor of future COPD exacerbations? Predictor. What can predict, like what, past COPD? Okay, well, I guess that was pretty obvious. Holoprosencephaly can be caused by mutation of what gene? It is holoprosencephaly. Mutations in, what is the gene? It's 13 or 18. It's one of those. No, it's Sonic Hedgehog. Never mind. All right, so Sonic Hedgehog, holoprosencephaly. We got Sonic right here. We got holo. Most common cause of acute cough? Viral? Whatever. Yeah, sure. I'm sorry, I'm yawning. I have to like try and stay focused. Common cause of persistent hemoptysis if you're above 50 years with significant smoking. I mean, I guess chronic bronchitis. Or no, lung cancer. Well, they mentioned smoking history. So cancer, lung cancer. That's it. All right. Congenital conditions with holoprosencephaly. We know one of them was, well, I mean, I know Patau and Edward, but other than that, Patau, fetal alcohol syndrome as well. So if you drink, nah, that's different. Fetal alcohol syndrome, just remember it. All right.
What are the 4 H's that increase the risk of CPPD disease, and what are the corresponding lab values? No memory hook.
All right. That was kind of helpful. 4 H's, hemochromatosis. I forgot the others. So, hyperparathyroidism, hypomagny, and hypophos. Hypo of the M, hypo in the P. So MP, hypos. Alright, so I guess we can try and remember it, but there's not really a proper memory hook as the narrator said. Indications, diagnosis, thoracensis. Am I boring you? I think I kind of am. I'm also kind of like in a state where I'm kind of yawning. I kind of need to stay focused. Diagnostic thoracensis indication. Why? Pleural effusion. What else? Loculated diffusion, possible empyema. I mean, good, cool. Chest X-ray asbestosis. I think asbestosis is the only one that's like kind of like lower lung fields. Pleural plaques. So you got plaques, lower lung field. I was kind of right about the lower lung field. I have to mention plaques as well. Pleural plaques, important to mention here. All right, now physical presentations of like holoprosencephaly. So what do you have? You have cleft lip, palate, and you have cyclid. So you have one eye, one lip. I'm kidding. That's not true. You have one eye and you have a cleft lip. Okay. All right. Now, how does the pleural fluid analysis in rheumatoid arthritis compare to that of SLE? What is the comparison? How does it compare? I guess rheumatoid arthritis is sort of, yeah, what else would I look at? I guess rheumatoid factor, but not as extreme as RA. I mean, I guess they're similar. But not as similar as you would think. Now, complication from tension, pneumothorax can lead to, so hypertension, tachycardia, and hypo. So what's that complication from tension, pneumothorax? I mean, it could be shock. What are we talking about? That was easy. Yeah. Posterior fossa, like malformations that can like kind of lead to a downward displacement cerebellum. What's that called? I forgot. That is Chiari. That's really Chiari. Possible fossa malformations that can lead downward. It goes down. What? The cerebellum. That's Chiari. All right. Now, 3 classic asthma symptoms are. I think we know shortness of breath is 1. Coughing, sneezing. Oh, what else? Wheezing, coughing, wheezing. Yeah, sure. What imaging modality is used to guide site of choice for thoracinosis? That's USG. Okay. Ejection fraction chain, acute mitral regurgitation. Well, what actually happens in mitral regurgitation? What happens is that it's not really much systolic. So what happens actually? I guess the difference becomes less, and then I guess it's increased. That's the same. Systolic is going to be. I guess systolic will be more. It depends, right? Systolic could be less. We have more diastolic because it comes back. Yeah, so you could have more of that. So ejection fraction could be increased. Okay, so that's something we have to kind of remember. Difference between type 1 and type 2. Type 1 is like both. I think that it's type 1 is the only one. It's the only one with cerebral tonsils that can kind of like herniate. Type 2, it's like tonsils, vermis. What was the other one? So you have medulla as well. You had to mention medulla as well, dude. Okay, which condition top of it may indicate as prevention of wrinkles, oral hair, leukoplakia, and acne. Yes, I will do that as well now. Okay, so I'm kind of in a dazed spot. I'm gonna have to really like stop right now. Continue after 50 minutes. All right, so I'm gonna see you after 50 minutes. I hope so.